Hi, my name is Kristin Halla. I'm currently a pharmacist and I'm practicing up in Iron Mountain, Michigan. How did I get interested in pharmacy? Well, I got interested in pharmacy when I actually started doing my undergraduate studies as I started working as a pharmacy technician at a retail pharmacy. Shortly after I started my job in retail pharmacy, I learned that I really appreciated the pharmacists that I was working with and I was looking up to them often. I realized I wanted to have a job like them for many reasons. I enjoyed getting to see that they were the go-to people on the job, and that was something that I wanted. I also appreciated getting to see the different patient relationships that they were getting to build. Even though as a technician I definitely got it to build those different patient relationships, I definitely valued getting to see the pharmacist in that role as well. Watching the pharmacists do their job in a retail setting was definitely something that I wanted to have in a career. Also, while I was an undergrad, I did some shadowing at one of the hospital pharmacies where I went to school, and I really liked to see what their job and their role was as well. And similarly to the retail pharmacist, I saw that they got to help people, which was something that I wanted to do. Also, as my interest in pharmacy continued to grow as I was an undergrad, I decided to take on additional role in pharmacy by becoming a certified pharmacy technician, um, which let me learn more and more about pharmacy. From the last slide, speaking about my undergrad studies, I actually did my undergrad training at the University of Wisconsin-La Crosse. I ended up going to school there for 4 years and received my bachelor degree in biomedical science in 2014. After undergrad, I was fortunate to be able to start pharmacy school at Concordia University, Wisconsin School of Pharmacy. And I did end up receiving my Doctor of Pharmacy in 2018. I really enjoyed my education at Concordia, and I still cannot believe that I'm done with school at this point in time. And it is really amazing to me that even though I graduated in 2018, that I've actually been practicing as a pharmacist for already 2.5 years. As I was finishing up pharmacy school at CUW, I had decided that I wanted to do even more training outside of my pharmacy education that I was just finishing up. I was interested in going into practicing into ambulatory care pharmacy, with my goal to be able to work in a clinic and provide pharmacy services to patients in that setting. Fortunately, I matched with a first-year residency program at the Milo C. Hempner VA Healthcare Center up in Green Bay, Wisconsin. I absolutely loved my first year of pharmacy residency and being able to practice as a pharmacist because I was done. I was done with my schooling and I got to actually go out and be what I had trained for the prior 4 years in pharmacy school. I loved getting to go to work every day. I had so many different opportunities where I got to expand upon the education I had got from Concordia. Some of my favorite experiences during this first year of practice were I got to practice often in a primary care clinic under different preceptors of different pharmacists that I was working with. In the clinics, actually, I get to see patients face to face or even talk with them on phone about different disease states that included diabetes, high blood pressure, helping people quitting smoking, different anticoagulation, different things like that I'd get to talk with them about. It was such a good experience to be able to work in these settings and talk about these disease states because I got to actually manage the medications that these patients were taking. As I got to manage their medications, I built relationships throughout the year, which brought me back to what got me interested in pharmacy anyway, was getting to help people and build these relationships. Beyond building relationships with the patients in these settings, I got to build relationships with the other healthcare providers around me as well, which was really rewarding. In addition to working in primary care my first year of residency, I got to help in a hematology oncology clinic. At this facility, we did have outpatient chemotherapy where patients would come in and they'd get their medications. I got to help determine what therapies patients would be taking. I would get to help make that therapy in our compounding area. Then I would get to verify and check that medication. And then what was most awesome about the experience is I actually could go walk the medication up to our oncology area, and then I'd get to talk to the patients as they were getting their chemotherapy and educate them about their medications and then kind of figure out if they were having any issues or concerns. Beyond that, I also got to help in the outpatient pharmacy during my first year of residency, where I, again, got to verify different prescriptions and I get to talk with patients and educate them. Overall, it was a wonderful year as a first-year pharmacist to get additional training after school, and I felt that Concordia did a great job to prepare me to do that training. Well, as I was finishing up my first year of training, I had decided that I wanted even more training and more education beyond what I had already gotten. I really had an interest in the ambulatory care pharmacy, so I actually applied to be I applied to go do a second year residency at the Boise VA Medical Center out in Boise, Idaho. So I was fortunate enough to go move out there for my second year. This also was a great experience as a second year as a pharmacist. I not only got to learn more about pharmacy and practice in a little bit different settings, but I got to move across the country for a year and go live in Idaho, which is just so awesome. As I did my second year training, I continued to build upon my education from Concordia and my first year residency in Green Bay. My second year was a little bit more unique though than what I had in my first year of residency training, in that I actually had a scope of practice. So what does that mean? I got credentialed in to have a little bit more prescriptive authority and other authorities at the facility that I was working at. So during the year when I'd get to see patients in clinic again, or talk with them over the phone, or see them via video visits, I'd actually have the opportunity to be able to prescribe the medications that I was working with for them. And this year, I got to see even more disease states and manage even more different medications than what I did prior. I got to see patients for things like HIV, hepatitis C, pregnancy, cholesterol, weight loss, so many more. It was great though, because the scope of practice that I had, I'd actually get to see my patients and manage their medications. Just like the year prior, I got to continue to work with other healthcare professions, and I even got to work in a hospital setting discharge program. In this setting, what was a little bit different than my clinic work is that I actually would go into our discharge pharmacy area and I'd get to help reconcile patients' medications from when they were in the hospital and they were going to be getting discharged out of the hospital. I'd find if there were any discrepancies or not and talk with the discharging hospital staff team about it. Then, if there were any med changes or if there were any medication changes that patients would need when they were going to be leaving the hospital, I'd actually get to go bring the medications up to them in their hospital room before they leave. So a type of meds-to-beds type of a program. This was such a fun experience. I got to go run up the medications to the patients and talk with them at the bedside if they had any questions about anything. And it was always enjoyable because patients were excited to be leaving, and then they got to get their medications and talk with the pharmacist right away before they left the hospital. Besides that, during my second year of residency, we also had a big focus of interprofessional education during this year, and that was really, really exciting for me because I got to practice building different relationships with other healthcare trainees. So we had a lot of different medical doctor residents, we had nurse practitioner residents, we had postdoc, psychology trainees, we had all these different trainees working together. In these settings, we got to practice in clinic together, we practiced in hospital together. Ultimately, we were building relationships and getting to value each other as other healthcare professionals, and ultimately learn to work together as a team to be able to provide care to our patients. Overall, this year was wonderful. Again, it just was a great transition as I had finished my pharmacy school a few years prior. It was a great building and stepping stone off of my first year residency. And then I got to finish second year residency, which overall was just a great experience. After I finished my schooling and my 2 years of residency, I started a job as a pharmacist at the Iron Mountain VA in Iron Mountain, Michigan, which is actually my current job. So, what do I get to do at my current job every day? So, what do I do? I am a pharmacist at the Iron Mountain VA, and I work in ambulatory care. My official job title is Primary Aligned Care Team, or PAC, Clinical Pharmacy Specialist. I'm a pharmacist that works in primary care, and I am part of the primary care, or PAC team. Other members of my team that I work with daily include nurse practitioners, medical doctors, nurses, dietitians, social workers, administrative staff, and many more. I help improve access to the primary care teams by helping manage patients and their chronic disease states, including medication management. Disease states that I am able to manage include pretty much anything in primary care. So I'm able to manage things like asthma, heart failure, COPD, diabetes, gout, cholesterol, blood pressure, vitamin D, thyroid, and so much more. Just like I had during my second year residency, I continue to have a scope of practice in the job that I'm at. So I actually get to prescribe the medications to the patients that I'm managing the medications for. So when they get a prescription bottle and they look at the name on the bottle, it actually says my name that I'm getting to work with them. Included in my scope of practice beyond getting to order medications, I'm also responsible for ordering labs, I can order consults, and I can even perform certain physical assessments. In addition, I can be consulted to help with different medication educations, medication reviews, drug information questions, formulary assistance, panel management, medication recommendations, and even so much more. What makes my role interesting is that I actually started it this past summer when COVID has been going on. So how has COVID actually changed my role is I don't really know because I've been practicing in it since COVID's been here, but I do know that we try to do as much telehealth modalities as possible. So majority of the patients that I'm working with in clinic are talked to via phone or by video. However, there are still patients that I get to see face to face. So how did CUW prepare me to become a pharmacist? CUW prepared me very well to become a pharmacist. The faculty and professors at CUW were always able to help, and I felt that they provided me the appropriate information and resources to help me gain my baseline pharmacy knowledge. Beyond that, though, the pharmacy staff was always approachable at CUW from my perspective, and I always felt like I could go to any professor's door and ask them a question or even send them a message if needed. What was also great during pharmacy school is that we had a lot of real-life applications of pharmacy that we got to be able to practice some other things that we were learning. We had patient care labs every year in the classroom that had us practicing the pharmacy information we were learning in the classroom and apply it to our simulated patients and providers right in the labs. These patient care labs apply directly to what I do every single day as a pharmacist in ambulatory care right now, which I appreciate getting that practice early on in school. In fact, it gave me the confidence that I needed as I went through school and to be able to do what I'm doing now. We also got to practice compounding different medications on school. This was really helpful because getting to practice making different medications and learning the processes behind it for both sterile and non-sterile medications is important to be able to have some of that background knowledge. But what's even more important is that on the day-to-day, and sometimes when I am at work, I do have to apply some of that compounding knowledge. In particular, where it comes up for me at this point in my job is that sometimes I'll have to help with some vaccine administration, and some vaccines do require a little bit of compounding to be made to be able to give. So that's a way that I apply my compounding lab at work currently. Beyond the classroom, CUW had us do some different pharmacy practice rotations outside of the classroom that were really awesome. So for example, rather than going to school for some of our training, we'd actually go on site and get some on-the-job training from different pharmacies. What was really nice at CUW is that we didn't just have to do these trainings or rotations down in Mequon or by the Milwaukee area. We actually could get a preference of where we wanted to go. And for me, I'm actually from the Green Bay, Wisconsin area, so I'd often go home for a lot of my rotations. This was really beneficial because I got to practice some of my pharmacy knowledge in school in the local area where I grew up, and then I got to start networking with some pharmacists up in the area where I was from. I like to share a couple great experiences that I had from doing these pharmacy rotations, which again is because of Concordia setting up these opportunities for me. One of my rotations that I got to do my last year, my preceptor actually took me with her out to Washington, D.C., and we actually got to go advocate for pharmacy at our nation's capital, so that was really awesome. Another thing on one of my other rotations that I had is one of the local independent pharmacies, they always would have a group of people go do a medical mission trip every year out to Africa and Uganda. And I actually got to go with them. Actually, my first year as a pharmacist, I went with them out to Africa and got to practice as a pharmacist there. So those opportunities, I feel like I would never have gotten if it wasn't for Concordia helping me set them up. Outside of pharmacy rotations and the things that we learned in school, Concordia actually had a lot of different clubs and organizations to get involved with if you wanted to. For me, this is something I enjoyed doing, and it's actually where I got to meet a lot of my classmates and build some different friendships with people. From a professional standpoint, the friends that I got from pharmacy school, we still talk with each other often, and in fact, a lot of us are working in different pharmacy settings right now, so we'll message each other if we've got different questions, and the relationships that we built were something that I'm really happy that I got to build those relationships in. So from Concordia, I had so many positive experiences during pharmacy school. I feel like it is important that Concordia gave me the training and the education that I needed, and they ultimately gave me the tools to be able to pass my boards for pharmacy and to become a practicing pharmacist. I feel super grateful that I got to go to school at Concordia, and if I actually had to go back to school again, I would pick Concordia again because I really enjoyed my time in education there. As I practice as a pharmacist now, it's interesting to think about what has changed in pharmacy from when I initially started getting interested in pharmacy, and I realized actually a lot has changed. In fact, pharmacy school, when I started, it actually really opened my mind to all the different opportunities that are available for pharmacists. I wasn't even aware of the opportunities that were out there for pharmacists before pharmacy school. I just thought there was retail pharmacy and hospital pharmacy. What I learned in pharmacy school is that there are other roles, and in fact, the job I'm doing right now, I didn't even know was a thing until I started pharmacy school. So that definitely changed my perspective. Another thing that changed, and this kind of relates to healthcare. Healthcare is always changing and ever changing. Is that the medications that are available out there? I've been working in pharmacy now for over 10 years, and I feel like every day a new medication is coming out, or there's some updated information about a current medication on the market. This is really exciting though because as a pharmacist, every day I'm constantly learning and getting updated on different information, and I definitely feel like Concordia gave me the tools and background knowledge to be able to know how do I know where to go to find this information, or how can I stay up to date with everything, because again, things are always changing, but it's also super exciting in my day-to-day. I'd like to conclude this presentation about me and my pharmacy experiences by just confirming and reflecting that I truly did appreciate the experience that I had at Concordia University School of Pharmacy. It allowed me to grow so much and let me get some different practices and experiences, and I know I wouldn't be the pharmacist that